Hey guys, Dr. McClimon back with McClimon Chiropractic, and today we're going to talk about how to eliminate knee pain. Guys, there's different causes of knee pain. Knee pain today affects about a third of Americans at some point in their life. Being overweight can cause knee pain. Every pound you're overweight can contribute to 4 more pounds of pressure inside your knee. So different causes of knee pain. Being overweight can cause knee pain. Having a meniscus, some of the more common ones that we see, having a meniscus injury can cause knee pain. Having osteoarthritis or arthritis in the knee can cause knee pain. A sprained strain of the knee causes knee pain. And then 2 of the ones that we see that we help that are different than orthopedic are subluxation or misalignment of the tibia and the femur, creating mechanical issues and knee pain. And then lastly, we have subluxation, and then we also have a pelvic misalignment or an imbalance due to either subluxation or a short leg, which creates a shift in the pelvis and then changes the mechanics and causes more stress in the knee. So those are different causes of knee pain. Now, treatment, we run through when you come in, we run through obviously getting a clear history as to the cause of the injury. Then we go through orthopedic tests to figure out what's wrong with your knee. So we'll run through tests to check your meniscus and to check your lateral collateral ligaments and check your anterior and posterior cruciate ligament, to check swelling in the knee so we can palpate the knee. Oftentimes there's swelling in the knee joint, which indicates a problem, right? So we go through different orthopedic tests to evaluate specifically the knee. We also use x-ray. X-ray can determine, is the knee space compromised? Is there arthritis in there? That's very helpful. Also helpful to check alignment. So if there is a possible tear due to the testing we do, we refer you out to an orthopedic to have a consultation. We can't fix a tear in a ligament. That obviously has to be done medically. So the thing that we do help with that obviously they can't help with is an alignment issue. So osteoarthritis in the knee oftentimes comes from a misalignment in the knee. A misalignment can contribute to osteoarthritis. It can contribute to a meniscus injury. It can contribute to chondromalacia patella, or like runner's knee. It can contribute to a sprain or a strain. And so what we do is we specifically evaluate the knee for alignment between the lower leg bone and the upper leg bone. Sometimes the lower leg bone will externally rotate, the upper leg bone will internally rotate, and that creates what we call a slingshot phenomenon, which allows the patella to track more lateral. It can create chondromalacia patella under the kneecap. It also can create inflammation within the knee joint, and eventually wear and tear and osteoarthritis within the knee. So obviously the sooner we catch that, the better. But how do we determine that? We determine that through evaluation, through x-ray, and if there is a misalignment within the structure of the knee, we can make specific adjustments to that, which addresses the root cause of the problem rather than just masking the symptom with a medication. The other issue people have knee pain, which we help with, is, like I said, an actual short leg. So oftentimes people have one leg that's actually shorter than the other, whether it's due to subluxation in the pelvis shifts and the leg drops, or it's from just one side actually being shorter than the other, which is many times overlooked. And so we evaluate for that through x-ray. If you do have an imbalance in the pelvis due to a short leg, due to subluxation, we correct that imbalance, which improves the mechanics of the back of the leg, reduces inflammation, irritation within the knee joint, and actually gets rid of, again, the root cause of the knee pain rather than just masking the symptoms. So those are some ways that we improve and help and eliminate knee pain for good, and that's through addressing alignment and through the knee, and actually through the pelvis. Better alignment, less irritation, and less inflammation, less pain. So guys, that's your tip. Look forward to seeing you on the next video. God bless.